So the next one's going to be the seated thoracic rotation mobilization. So this is a good one. We know in especially the mid to lower thoracic, that's one of your primary rotational spots. So you want to watch for people that are really restricted into rotation. It can cause a lot of problems in the hip and some other areas. So this is a nice technique if you've got somebody like that. So I'm going to get her on the plinth, on my table, side sitting. I'm going to come up beside her, and I kind of do like a half kneel here. I'm going to reach under this arm, have her contralateral arm come up and under mine to her shoulder, and then the same arm is going to go up on top of my hand, right? So here I can get pretty close to her and kind of control her rotation, okay? I'm going to take, again, the pad of my thumb on the other hand and palpate the spinous process of the segment that I want to rotate. So here we're working on left rotation, so I'm on the right spinous process, right? I'm going to get her in pretty close where I can control her motion, get right on that spot, and then I'm going to kind of facilitate her rotation to the left while I give just a little bit of pressure, kind of facilitating that spot right there, okay? Now, depending on your irritability of your patient, if you've got somebody that's highly irritable, they may not be able to tolerate going through any more than just like a pain-free range of motion, so it might be kind of a small movement. If I've got somebody that is more stiff dominant, they're not real painful, I may take them to the end range of that motion and then mobilize there. So if she's very stiff dominant, bring this hand back up here again. Very stiff dominant, I'll go ahead and find that spot. I'll go ahead and take her all the way to her end range, and then maybe I just sit there and do a little grade 4, right? So if I've got her rotated, I've taken up all the slack in that joint already. Sit there just like that, okay? Now, if you'll move to that end of the table, we'll go ahead and talk about the muscle energy technique and turn facing the camera for you. So these muscle energy techniques are a really good way. We'll talk about one in the lumbar spine and with thoracic extension in a few minutes. Really good way to follow up mobilization to try to get some extra neural input to have the kind of mind-body connection where we're starting to control the new range that we've created. So say that we just worked on her thoracic rotation. Again, she's not rotating well to the left. We just did a UPA, we just did a seated rotation. Now we want to kind of integrate that in. So I'm going to have her kind of cross her arms like she's hugging herself, right? I'm going to come up behind her. And now I'm going to give you some pressure going this way. I want you to let me move you, but very slowly, all right? So you're resisting me, but not enough to stop me, okay? So I start right here, start giving a little bit of pressure, trying to get her to get it to be a real smooth, controlled motion. When we get here, I'm going to reverse, go back. I want her to keep at the same speed the whole time, and I may just go back and forth there a few times. What I'm looking for, again, is a very smooth movement with somebody that's got problems with this, that's not getting some good neuromuscular control. You're going to see a lot of jerkiness, or they may lose it at a point. So you may have to do this for a while or for a few sessions. Most of the time, when you mobilize and then do this motion, these muscle energy techniques, you'll get a really big swing in their active range of motion and control.